Things are really starting to heat up with Medicare. And if you haven't paid attention to the Inflation Reduction Act and what it's doing to your Medicare, you better pay attention in this video. Hi, my name is 𝗲𝗏. Been helping people with Medicare for over 20 years, all throughout the United States, and we can help you too. But there's something that just came out you need to be aware of. See, with Medicare, you have to choose. Do you want to have original Medicare with a Medicare supplement or a Medicare Advantage plan? More people are choosing Medicare Advantage plan because they're so heavily marketed and they tout extra benefits. But it's important that you know about things that are happening like this because your Medicare Advantage salesperson won't be telling you about this. It's a story that just came out, and this has been covered by a whole bunch of different organizations. This one from the Hospital CFO report, probably something that you haven't read, says Medicare Advantage provides health coverage to more than half of the nation's older adults, but some hospital systems and health systems are opting to end their contracts with Medicare Advantage over administrative challenges. What does that mean? Among the most commonly cited reasons are excess prior authorization denial rates and slow payments from insurers. In 2023, Beckers began reporting on hospitals and health systems nationwide that dropped some or all of their Medicare Advantage contracts. In January, they released a survey from 135 health system CFOs and found that, this is interesting, 16% of the health systems across the country are planning to stop accepting one or more Medicare Advantage plans. But it gets worse. Another 45% said that they're considering the same but have not yet made a final decision. 45% of the healthcare systems that are out there are considering dropping potentially your Medicare Advantage plan. The report also found that 62% of CFOs, chief financial officers of the hospital systems, believe that collecting from Medicare Advantage is significantly more difficult than it was 2 years ago. So this is not the same as it's always been. It's been getting progressively worse. So we cite all these different healthcare systems, and I'll link this in the description of the video so you can read through it yourself. But I want you to pay attention to this one notification that came out from a health plan to the members so that you can see what they're sending out to everybody and what's going on. Let me see if I can zoom in on this for you. Contract negotiations are part of the relationship between healthcare providers and insurers. We're only talking about Medicare Advantage. We don't have this problem with original Medicare and the Medicare supplement. I'll show you the difference in just a second. This is only Medicare Advantage. We need our insurance providers, this is from the healthcare system, to its clients. We need our health insurance providers to agree to reasonable contracts that include fair payment that reflect true cost of the market. So it says, when does this contract expire with, in this case, it's talking about Humana patients with this hospital systems. Altman hospitals will no longer be in network with Humana insurance plans after July 1, 2024. Now, why is this important? Because Medicare Advantage contracts are for the whole year. It's from January 1 for you to December 31, that is your Medicare Advantage year. And as I've continued to say for years and years and years, the problem is with Medicare Advantage and providers, the providers can leave the network anytime they well please. They can leave in January, right after you signed up. Wait a minute, but I'm stuck with a year. So if my primary care doctor and my hospital decided they want to leave the Advantage Plan network because they're just mad, they're just sick and tired of them, what happens to you? Can you then change your Medicare Advantage plan because you put your hope and faith and trust in your doctor and the network and the hospital system? No, you can't. Because again, you are stuck with your contract with Medicare Advantage for the whole calendar year. But as this proves, they can leave anytime they dang well choose to. And this hospital system is leaving for all the Humana people in their Medicare Advantage. Altman physicians, woo, that's a good one, will no longer be in network after August 1st. I've had a lot of coffee today. This will affect your access to all the services our office uses to provide your medical care, including lab work, diagnostic services, urgent care, hospital care, and specialists. All gone. So you can't change your Medicare Advantage plan. You can't go just anywhere or it'll be out of network. This hospital, if you relied on them, sorry. If I have traditional Medicare and the Humana supplement plan, totally different story. Not Medicare Advantage, but you have a Medicare supplement and original Medicare. Can I continue? It says traditional Medicare continues to be accepted at all Altman facilities and pretty much all hospitals in the United States. So the Humana Medicare supplement is not impacted by these changes because it's a supplement to original Medicare. There's no network with original Medicare. It's any doctor and any hospital in America that accepts Medicare, which is pretty much every single one of them. So if you have a Medicare supplement, you don't even need to worry about this. But here's the deal. With the Inflation Reduction Act, we're going to have now, I believe, and this is my prediction, and I'm always right, we're going to have millions of people finding out that their Part D drug plan that they've had paired with their Medicare supplement, because on original Medicare, let me just show you that. On original Medicare, you have two things. You have your original Medicare and then a Medicare supplement, right? The choices that you have are to either go to original Medicare and get a supplement or give up your original Medicare for a Medicare Advantage plan. So if you're on original Medicare and you opted to get a supplement and then probably a Part D drug plan, a standalone drug plan, this is what's happening. And we just got our first clue about this today, as a matter of fact, with a plan in California. I won't give you details specifically because we're not allowed to. We're not allowed to talk about all of our first looks, all of our previews, all of our premieres with the insurance companies until October 1st of every year. That's just the law. We can't tell you. But I just saw them this morning, and we're pushing $200 a month on this one particular, can't tell you which one, Part D drug plan. Now, this is going to have the same impact across the whole country because the Inflation Reduction Act, which did nothing to stop inflation, put the cap for next year on all of your Part D costs. Cap, it's fantastic, right? With every action, there's an equal and opposite reaction. It's Newton's law. And here, the reaction is going to be horrible. We've already heard it. And we heard earlier this year, once this thing was passed, the insurance companies were telling us, we're going to have to recoup those costs somewhere. And we're going to do it in one of three ways. One, increase your premium on your drug plan. It's going to be super high. Number two, restrict your formulary. That's the list of drugs that are approved for that drug plan. Or three, change which tier those drugs are on. All of it means bad news for Part D drug plans. So what's going to happen is if you're on a Medicare supplement plan and you have a Part D drug plan, standalone drug plan, my prediction is, and watch and see if I'm right again, the drug plan itself might cost as much as the supplement, which is insane. Last year, we had drug plans that cost virtually nothing, or 50 cents a month, or 60 cents a month, and come full circle to the next year where they're going to be possibly into triple digits, depending on where you live. In triple digits, I mean over $100 a month for a drug plan. So what's that going to do? It's going to drive many seniors, many people on Medicare into, for the very first time, Medicare Advantage. They're going to be welcoming them with open arms. The Medicare Advantage companies are coming. And if you get on a Medicare Advantage plan, I just want you to have the truth about what also is happening at the same time with Medicare Advantage plans. That's why I'm bringing this to you. So don't jump ship just that quick and say, I'm going to go to one of those zero premium Medicare Advantage plans. Now I have to give up my Medicare supplement and my Part D drug plan. You may have to. And if you do, I hope you choose us to help you with that process because we have access to the best ones in the country. But I just want you to know, if you get sticker shock, if you get a massive updated rate on your Part D drug plan, then you need to look at all of your options, and that's what we can do for you. And I mean all your options between keeping your original Medicare or doing a Medicare Advantage plan. You better have somebody with experience guiding you through this process, and that's what we have, is experience guiding you through this process. So regrettably, Humana is unwilling to work with us to find a reasonable solution. Additionally, Altman is routinely facing burdensome administrative processes with Humana, resulting in delays in patient care. Whatever could they be talking about? Probably the things we've been bringing you, like prior authorization and denials. These include inadequate reimbursement, delays in prior authorization, and denials of claims. There it is. So this is just one example. And again, this article goes over 15 different health plans across the country. They're doing it with many different plans. United Healthcare is mentioned, Humana is mentioned, Anthem Blue Cross Blue Shield is mentioned. It's a lot of different networks. Aetna is even mentioned here because the hospitals are just sick and tired of it. So what does this mean? It means if you're on a Medicare Advantage plan, you better look closely at who's advising you on which plan to go with for the next year. These plans are, like I said, annual plans. They change drastically now. They change every year. So you better pay close attention and have somebody working with you that you can trust. So let me show you one other thing. We talked about every action has an equal and opposite reaction. Well, in California, they thought they were going to do something fantastic. They thought they're going to help the seniors in California to get on those wonderful Medicare supplement plans, because people on Medicare Advantage suddenly find out, usually this happens in our experience between the ages of 68 to 70. When things just start to break down, they find out that that zero premium Medicare Advantage plan is not all it was cracked up to be. So now that they've got something really bad going on, they suddenly want to leave Medicare Advantage with the network restrictions and the prior authorization restrictions and the denials of care that are routine, that we've documented for years. They want to get out of that plan because it was free and get back onto original Medicare, which is any hospital, any doctor, and pick up a Medicare supplement. But wait, if you're outside of your 6-month open enrollment window, in most all states, certain states are different, like New York, but in most all states, you can't just go pick up a Medicare supplement now that you're unhealthy, because Medicare supplement companies can and do underwrite you. And underwrite means they just ask questions. They ask your health questions. So in California, they thought, since this is such a problem with Medicare supplement companies denying care for people, let's just pass a law that they can't do that. We'll do like New York did. And in the state of New York, they passed a law that you can get a Medicare supplement plan anytime you want to. The only caveat in New York is it has to start on the 1st of the next month. Otherwise, it would be complete pandemonium and chaos. So in New York City or New York State, you can not have a plan at all or have a very inexpensive plan. We recommend high deductible Plan G in the state of New York. It's a tremendous value. We can explain why. But then if you get sick, you get something going on that's going to be significant, switch over to regular Plan G. And does it cost a lot? That's the rub. See, in New York, the plans are probably 5 times what they would cost in most any other state. Certainly in states like South Carolina, Georgia, North Carolina. The rates in New York City are so crazy because the mandate is to the insurance company, you have to take everybody. So they can't underwrite anybody. So the law of unintended consequences is what's going on here in California. Let's take a look. California tries but fails to fix a major Medicare loophole for seniors. Is it a loophole? It goes on and says, many seniors are grateful when they turn 65. This is really good. You should see this. I'm telling you, really. It says what I've been saying for years. Turn that off. Many seniors are grateful when they turn 65, and now they're finally eligible for Medicare. But to get enrolled, they first have to make a big decision, choosing a Medicare plan. The initial choice is to go with traditional Medicare or give it up and go to Medicare Advantage. Traditional Medicare has deductibles, copays, and coinsurance, and the extra costs can add up. To fill the gaps, people often buy a supplemental plan called Medigap insurance. We're experts on that. So you have original Medicare, which is anywhere you want to go. Then you put a supplement on top of that, which pays the other 20%, and you're good to go. But you can't get that if you're already sick and you've been on Medicare for longer than 6 months. Quote, one of the main benefits of Medigap is that it provides people on Medicare predictable expenses because they pay monthly premiums to avoid unpredictable expenses if they get sick, said Tricia Newman, executive director for Kaiser Family Foundation's program on Medicare policy. Absolutely true. See, with Medicare Advantage, you have zero premium, then all of a sudden it hits the fan and you're paying your maximum out of pocket, which could be $3,500, $6,500, $8,000 out of pocket. So you go from nothing to out of control crazy. This combination, original Medicare and a supplement, also gives people the most options in choosing doctors because most accept traditional Medicare. There it is in black and white. The other option for a newly eligible senior can choose is Medicare Advantage. This plan, sold by private insurance companies, streamlines the upfront cost. Matter of fact, it's no cost at all in many plans, making a separate Medigap plan unnecessary. No, you don't need a supplement, and you can't supplement a Medicare Advantage plan because it's a complete replacement of your original Medicare. Insurance companies often heavily market, they sure do, they heavily market those Medicare Advantage plans because there's tremendous amount of profit. In my case, it's 2 to 3 times the commission if I sell you a no-cost Medicare Advantage plan, as opposed to explaining those two different choices, supplement or advantage, and getting you a supplement plan. I make way more money by signing you up for a no-cost plan. Isn't that crazy? Because of the initial appeal of Medicare Advantage plans, again, no cost in most cases to you, over half the people eligible for Medicare opted for a Medicare Advantage plan last year. But there's a what? There's a major drawback to Medicare Advantage plans. What could that be? They lock patients into a preferred network of doctors and hospitals, narrowing options for treatment. That's an understatement. They might be 65, 66, or 67. In the scheme of things, they're at their healthiest, but it could be that over the course of several years, they develop a serious illness, Newman said. And guess what? Based on real life experience with tens of thousands of people, they do. This is exactly what happens. The limited nature of the Advantage plans, limited nature, means seniors might not be able to go to the specialist that they want, or as we just saw, the hospitals anymore. Sometimes seniors decide they'd rather go back to the flexibility and choice of providers available under traditional Medicare, and they try to switch back. That's like driving a car the entire time while it's under full warranty, bumper to bumper warranty. Then the day after the warranty expires, everything goes wrong. And you take it back to the dealer and say, hey, can you just fix this for me? I know it's out of warranty, but things are really, really wrong now. I want you to just go back to that time when I could get everything fixed and fix it for me. It doesn't work that way. They might be stuck. If they try to switch back from an Advantage plan to Medicare supplement, after the first 6 months of enrollment in Medicare, there's no guarantee they can get a Medigap policy to pair with traditional Medicare. Certain states you could, most states you can't. And we're experts in here on the underwriting process, which means some insurance companies have certain questions: height, weight, diabetes, how long ago did you go into the hospital last? Have you had cancer? And if so, when? Those kind of things. They vary from different company to different company. So literally, if you have an insurance agent who is captive, which means they only work for one insurance carrier, no matter who it is, let's say they're employed by Humana. You go to a Humana seminar. All they can sell is Humana. United Healthcare captive agents, same thing. The only thing they can sell is that one brand. So if they tell you, nope, you can't get our supplement, is that the end of it? No, it's not. You need to go to an independent broker. It doesn't cost anything to use us, costs nothing, and let us look at the entire market. We have tons of different choices with different underwriting criteria. So just because somebody told you that you're declined and you can't get a supplement does not mean the end of the world. Now, if it's something catastrophic, and we have a website that explains what that is, that may be the case, and you may be limited to just going to another Medicare Advantage plan, maybe one that's better for you. This website that's right here explains the underwriting process and even tells you what some of those questions are. So let me go back to the story. Private insurers who issue Medigap plans have the power, to refuse coverage or set a high price once the 6-month window that you had has closed. Quote, people can be denied a policy because they have a pre-existing condition, or they can be charged more, or they can get the policy, but not for the particular condition that will require medical condition. That's not true. They cannot accept you for everything else and then deny you for one condition that you may have had before. That's not true, Mr. Newman. These coverage denials and price hikes were common in the individual health market before the Affordable Care Act. That's true. They could before underwrite you for a health plan, an individual plan. They can't now. The ACA's regulations don't apply to seniors. seeking a Medigap plan after the 6-month window. We explain this every single day to folks. They're like, well, I heard you can't ask health questions anymore. Under 65, that's true. So what happened? California takes a stab at throwing a law out there to get those insurance companies in line. A bill that would have changed this was introduced in the California legislature this year. Driving the effort was concern among legislators, always their hearts in the right place, just give away all the benefits and get those insurance companies to come on board. Concern among legislators that California seniors on Medicare Advantage plans were facing fewer and fewer choices in their networks. That's an understatement. In 2023, Scripps Health, this was a major deal. We helped lots of these folks. Scripps Health, a major San Diego hospital system, stopped altogether accepting Medicare Advantage plans, saying the plans paid less than other insurers for the same treatments. And it's not other Medicare Advantage insurers, it's original Medicare and a supplement. That's what they're comparing it to. And they required doctors on Medicare Advantage to navigate prior authorization protocols that were burdensome and time-consuming. Well, it's more burdensome for the senior who's denied care on Medicare Advantage, I can tell you, than the frustrated doctor who continues to try to get that authorization. Meanwhile, the senior is writhing in pain, waiting for approval from a Medicare Advantage company. That move sent seniors in the San Diego region scrambling to sign up for traditional Medicare, supplemented by Medigap plans. I know our phones rang off the hook. The high number of people who found Medigap plans unaffordable drew the attention of State Senator Catherine Blake Spear, who put forward this bill. I'm going to put out a bill and make this happen. 4 states did reform their Medigap laws in the 1990s: Connecticut, Maine, Massachusetts, and New York. The rest, including California, allow Medigap insurers wide leeway in setting prices and issuing denials. Not denials of care. Once you've got it, you're good. The denial is whether we accept you or not. And again, we're experts on that. California's bill would have created a 90-day open enrollment period for Medigap every single year. That would allow seniors to opt in or out each year and not be denied or face exorbitant premiums due to pre-existing conditions. The Leukemia and Lymphoma Society became major supporters of the effort to pass the bill. I bet they did. Cancer, this is important. Please, if you ever known anybody that had cancer, my gosh, and they had to go through Medicare Advantage to get their cancer treatment, it is a nightmare. Quote, cancer or any chronic illness is very, very expensive, and that's why having supplemental coverage is important, said Adam Zarin, a policy analyst for the society. The second part is about making sure patients have access to the best healthcare available. Leukemia and other blood cancers are more commonly diagnosed in adults over age 55. That was the case for Oakland, California resident Judith 𝗵𝗵𝗱𝗆. She was 58, working as a physical therapist, when she found out her swollen and painful eye was a symptom of multiple myeloma, a cancer of the bone marrow. 10 years after being diagnosed, she became a patient advocate in the effort to reform Medigap in California. Quote, it's the options, it's the choice that matters. She has a Medicare Advantage plan. I don't know what her agent was thinking in this case, because she already had the condition and then put her on a Medicare Advantage plan. Or maybe she didn't go to an agent. She just got one of those things in the mail and said, no premium, this is great. For the moment, she's satisfied with her network of choices. But with her cancer, traditional treatment options often stop working to manage the disease. She wants the flexibility in the future to seek out different clinicians or even experimental trials. Quote, these slots are highly coveted and it's very hard to get in from an Advantage plan. The Advantage plans aren't really running these cutting-edge clinical trials. But unless regulations change, she will have to stay in Medicare Advantage. She thinks it's unlikely she could get a Medigap policy that would allow her to return to traditional Medicare. It's not difficult or unlikely, it's impossible in her case. There's some evidence that this is funny. What an understatement. The understatement of the century. There's some evidence that indicates cancer patients may have fewer options in Medicare Advantage. Oh, say it ain't so, Joe. A recent study by, well, this might be a good source, the Journal of Clinical Oncology found Medicare Advantage beneficiaries have significantly more barriers in accessing optimal surgical care. when compared with people of traditional Medicare. Well, if that doesn't convince you that you should maybe look harder at that choice of the free plan or not, Medicare Advantage beneficiaries have significant barriers in accessing optimal surgical care when compared to people of traditional Medicare. That ain't just Chris saying that. Industry fights back. As the bill was being debated in the state capitol, Stephanie Watkins spoke to lawmakers on behalf of the insurance lobby. Here we go. If more sick Californians are able to move on to Medigap plans, Watkins argued for the industry, insurance companies would have to raise premiums on everyone. That's true. That's what they did in those other states that we just referenced that changed their law and said, you can't ask underwriting questions. What happened to the rates? Through the roof and now unaffordable. Quote, we're concerned with the potential devastating impacts this bill could have on the 1.1 million seniors who, by no fault of their own, would experience significant rate increases on their supplement if this bill were passed. A state budget analysis of the proposed bill found the average Medigap premium would increase by 33% or $80 a month. That's just the first year. It would be so unaffordable for everybody. Once the state mandates, hey, you insurance companies, you have to give away this benefit to everybody. And the insurance company's like, well, what am I going to do about that? Am I just going to take it on the chin? Heck, no, they're not. They're going to pass that cost on to everybody else. So when you regulate something to death, the law of unintended consequences means somebody else is going to suffer from that. And it's absolutely true in this case. You can't just regulate this away. For people with modest incomes, people of the sort of lower end of the income scale who have Medigap, they might feel priced out of the market if that happens. You're dang right they would. In the end, the bill failed to make it out of the Appropriations Committee to advance to a full vote in the Senate. Zorin blamed legislators for siding with the insurance companies or those people who like their Medigap plan because they can't afford it if you pass a law like this, but said his group will keep pushing for this reform in future sessions. Why don't you get on Medicare, sir, and start paying your own Medigap premiums, and then what you already know from your own budget committee, then you say, can I afford 33% raise in my premium? Could I afford it if it happened again next year? What about the next year? Could you afford it then? Why don't you stay out and let the people who know how things work with rates figure out the rates? Judy 𝗵𝗵𝗀𝗃 was also disappointed. Judy, you should call us because we have tricks of the trade. We can help you. For now, she'll continue to focus on educating friends and other cancer patients about their Medicare options. What do you think she's going to drive her friends into doing? TikTok. So that they know what they're signing up for from the start and how difficult it might be to change. Yeah, that's what we're doing. We're educating people on what the differences are, and you should know it from the very beginning. This is the Medicare and You Guidebook. Everybody should know what this is. And in the Medicare and You Guidebook, it clearly states you could have original Medicare, which you go to any doctor or hospital that takes Medicare anywhere in the country. The Mayo Clinic, Johns Hopkins, Cancer Treatment Centers of America, everywhere accepts Medicare. So you could have that, top it off with a supplement. Yes, it's not going to be free. Well, was your employer insurance free? Was your individual health insurance free? For most people, no. They're used to paying for quality care. Or you could have a Medicare Advantage plan where they decide where you go, they decide what treatments that you get, they decide when you're going to be denied, and they decide when your doctor is going to jump through hoops to get you the treatment that you need. If anything we've ever done has helped you in any possible way at all, please give us a thumbs up on this video. It really helps the algorithm. And the best thing you could possibly do to help us and help other people is share our information with somebody who's making a choice about what they're going to do about Medicare. Because it's overwhelming. We hear it all the time. Like, I'm so confused. There are so many options. And most people turning 65 have a stack that big on their table, wondering, what am I going to pick? Do I pick the plan that looks the best, the lowest copays? By the way, there are no copays on Medicare supplement, except on Plan N in small cases where you have to go to the doctor, and it could be up to $20, typically about $13 to go to the doctor on Plan N Medicare supplement, which we have a whole video series on that you should probably get involved with. That's at plannmedicare.org. See if I've got a little note on that so you can check it out. Yep, I do. planinmedicare.org. It's a really cool plan. Most agents will push you into Plan G, the Medicare supplement. It does cost more, but there are no copays there. It's depending on where you are, and every place is different. The value proposition for being on a Plan in Medigap plan may save you hundreds of dollars every year. And then over the course of time, because the disparity between the rate increases of the two, Plan in could save you tens of thousands of dollars over the time that you're on Medicare. But we can go through it with you because everybody's unique. You're unique on how often you have to go to the doctor. What are you treating right now? What plan are you on? And is that the best one for you? Because here's the deal. If it is the best one for you, we're going to recommend that you stay right where you are. So you're saying, Chris, how much does it cost to get your expert opinion on plans in my area? And do you service my area? Yeah, we have the whole country, and it costs you nothing. So it doesn't cost us anything. You pay us absolutely nothing. It's just like your life insurance policy or your car insurance policy. You don't go down and write a separate commission check to your agent that helped you with that. Same thing with health insurance. We're paid by wherever you end up going. But being independent allows us to be independent in what we're recommending to you. We'll show you all the different ways you can go. We'll show you what your options are, but we'll do it with honesty and integrity. And if you already got on a plan and it's the best one for you, great. But those Medicare Advantage plans change every stinking year, and they can change in a drastic, dramatic way. So if you had an agent that put you on a Medicare Advantage plan last year, and you want somebody else to help you with the plan this year that might have access to a wider variety of plan options for you in your state, that too would be a good reason to reach out to us. Get on our list so we can examine what you've got and then help you when the appropriate time comes out. Woo, that's a lot to go over. And I hope some of it was of value. Please put a comment below so I can see if anything that we're doing is helping. Just a comment, a real quick comment on, Chris, I hate your videos, or I learned something new today, or I'm going to share this with somebody that's facing the choice of what to go with the free plan. And so many times people comment, I've seen this thousands of times, they're like, I tried to tell my friend, I tried to tell my husband, I tried to tell somebody, but when they're turning 65, everybody thinks that they're immortal and they're invincible. And the good health that they've enjoyed for 65 years is going to continue right through retirement. And that's the trick. That's the snare. It is, everything's going to be the same. Just take this easy plan. It's going to be no problem at all. Well, as we've proven with all these experts and the hospitals, it's not the case after you're 6 months out from having joined Medicare. You pretty much have one chance to get it right. After that, you may have a do-over with the trial right, and we can go through those options for you. But we have options that a lot of people don't know about. So reach out and we can help you. God bless you. Thank you so much for watching. We'll see you next time. Make sure you subscribe to the channel.